One of the problems with men, I think, really think we're hopeless because so many men self-diagnose. They just tell you, I'm okay, look, I'm okay, I'll be all right. And you just feel like belting the tripe out of them and saying, well, let someone else make that decision about yourself. Women seem to be infinitely tougher, whether they've had more experience about all of this than men have, I don't know. But that's the message too we have to get across. Stop self-diagnosing. Stop pretending you can be the architect of your own salvation. You can't. Give someone else a chance to just see how well you are or how not well you are. And once you get people there, other people will do the work. Our next speaker is the President of the Urological Society of Australia, David Malouf.
Thank you, Alan, for the introduction. Honourable Minister Wayne Swan, Treasurer, federal parliamentarians, of which there are many in the room, Mr Graham Johnson, Chairman of the PCFA, Philip and his St Vincent's team, distinguished guests, ladies and gentlemen. It gives me a great pleasure to be here today representing the Urological Society of Australia and New Zealand. And I've noticed that you provided quite a urological forum with the running water in the background. So anyone who feels the need to disappear out back briefly, please feel free to do so. The launch of the DVD, So How Do You Choose, represents a culmination of a great deal of work by Philip Stricker and his team at St Vincent's. The DVD, which I have had the chance to review, will be a valuable addition to the body of literature available to men and their families who are affected by the diagnosis of prostate cancer. Prostate cancer is a significant disease, not only to the individual and to the immediate family, but to the community as a whole. You've heard the statistics from Alan, they're worth repeating. This year we can expect 20,000 men to be diagnosed with prostate cancer. 3,000 men will die of prostate cancer. There are more than 200,000 men living with the diagnosis of prostate cancer as we speak. And there are many more hundreds of thousands of men who have the disease and are currently undiagnosed. These are very sobering numbers, and we can no longer say that men will die with, not of, prostate cancer. There is strong evidence that the early diagnosis of prostate cancer will impact upon survival. The recent European screening study confirmed this. There has been criticism of the trial in terms of the number of men needed to treat to save lives, but the commentary fails to acknowledge that not all men diagnosed need to be treated, and surveillance alone is appropriate in many situations. Where treatment is warranted, with modern advances in surgical and non-surgical techniques, men diagnosed with early prostate cancer can often be treated with excellent outcomes and minimal side effects. Prostate cancer treatment involves many medical disciplines. General practitioners, radiation oncologists, medical oncologists, and allied health professionals collectively work to treat men with the disease. However, it is commonly the urologist, such as Dr. Stricker, Dr. Costello, Tony Sutherland, many other urologists in the room, who take central responsibility for the care of these patients. In Australia, we have a urology training program which is second to none, and men can be confident that their diagnosis and management will be conducted in a professional, expert, and compassionate manner. The limiting factor remains the lack of the awareness of the disease and the potential benefits of early diagnosis. Public information campaigns are vital to address this information gap. The work done by the PCFA and other community-based groups is recognised and appreciated. The urological community looks forward to working with the PCFA, with government and the media to continue to raise the profile of this significant disease. Congratulations, Philip, on your achievement in producing this DVD. I'm sure it will be a very useful resource for many men who struggle with the diagnosis and the question of how to make decisions about treatment options. We collectively need to encourage men to take ownership of their own health. Thank you.